Hi, this is Yvette, and welcome to the Transformation Project. Today on the Transformation Project, we are so excited to be speaking to Dr. Brian Peterson. Dr. Brian is a chiropractor. He is a certified Primal Health coach, and he's also my husband. And so it's super exciting to be able to have him on the show today. Dr. Brian grew up in Arizona, and his heroes became firemen, policemen, or guys in the Secret Service or the Army. He loved stories of brave soldiers risking their own lives to save those of other guys in his platoon. Dr. Brian got to live out his dream when he graduated secondary school and joined the United States Air Force, where he became a firefighter. The firefighter's motto goes, "Fighting fires and saving lives," and he loved it. Dr. Brian began to realize, though, that what he was really doing as a firefighter was helping people after it was too late. The car crashes, the heart attacks, the rescues were like waiting for someone to fall from the cliff and then attempting to save their life. What he really wanted to do was get to the top of the cliff and stop people from falling off in the first place. One day, Dr. Brian's grandma gave him a single-page description of what chiropractic was. He loved the philosophy of chiropractic that health comes from within and that chiropractic can help the body express itself better. He began to form a philosophy about health, that the body is amazing. The self-healing and self-regulating properties of the human body, anything that has life really, is remarkable. The chiropractic lifestyle not only reduces the stress on the body, but it also increases the body's ability to adapt to stress. The chiropractic lifestyle gives Dr. Brian a map for where he needs to go with regards to his health, learning how to improve your ability to adapt to stress by getting back to nature, learning how to eat, move, and think as humans should. And so today, please join me as we talk to Brian on all the inside scoop about chiropractic, all the questions you've wanted to know, and probably some that you didn't even know that you'd thought of yet. So let's get to it with today's episode.
Hello and welcome to the Transformation Project, a podcast and community for women who are looking to transform into the best version of themselves no matter where they are at. A place where you can listen, learn, and laugh along with us as we dive deep into different topics to help you live a happier, healthier, and more fulfilled life. Remember, we are all learning here together, and therefore the content and opinions of the hosts and our guests should not be taken as medical advice. Please consult your healthcare professional for any medical questions.
Hey, welcome guys. It's really cool to have Dr. Brian Peterson on our show today to come and share some of his wisdom and help us to find the best way to do some healing around our spinal health. Welcome, Brian.
Thank you. I'm excited to be here. I love your show.
Thank you. Did you like my show on poo?
Yes.
I didn't even have to pinch him under the table to say
yes.
He loves our show.
Thanks so much for coming on today, Brian. I was really keen to have a bit of a chat with you, just to give our listeners a bit of perspective. I have recently hurt my back at work a couple of weeks ago, and usually I would come and see you, Brian, but it was just a little bit too far and I didn't have anybody to get me down to see you. So we did want to have a bit of a chat about spinal health and how we can try and help people to avoid getting themselves in this situation over and over again, obviously. Personally, I know that there's a lot of opportunity or a lot of times when you work in an environment like myself, where it's a physical role and I'm moving around quite a lot and really kind of putting myself on the line. But I do tend to every now and then just do something magical and then all of a sudden it doesn't work anymore. So I would love to get your best kind of hints about why people would generally need to see a chiropractor.
Well, specifically for your case, I think you've had problems off and on for a little while, right? You were in a sedentary job previously?
Let me think. Post-COVID, yes. Post-COVID, yes. And then probably since January, this role has been a little, definitely a lot less sedentary, actually, a bit more mobile, moving around, up, down, moving sideways, lots of different physical activity. So yes, I have gone from a sedentary role where I wasn't doing a lot of movement to now having to do quite a bit and also quite quickly. So there's a bit of time pressure in getting the colonic beds, as an example, ready before another client comes and, making them speak and span.
Okay. Well, I think, a lot of times spinal problems are things that happen over a period of time, right? They accumulate And so a lot of us are sedentary a lot of the time these days, office workers. I mean, even if we are up and moving around, oftentimes we do sit a lot. And so I think like one main takeaway is that your spine wants to move. All those joints in your spine want to move regularly. And so if you're in a seated position for a long period of time, your spine and your spinal joints can start to degenerate, kind of like having a cavity, right? So for those people that are in a sedentary, like sitting position, getting up and moving around frequently is really important. We used to say getting up at least once an hour would be good, but I've read a couple of studies recently, and the outcome was that we should really be getting up every 15 minutes. It doesn't have to be a full workout, just for like a minute or two, just to establish a little motion through your spine. So that over a long period of time, that can be a good strategy for you if you sit at a desk, is just getting up and moving your spine and moving those spinal joints quite regularly. What happens in a lot of cases, I think you mentioned that you just did something simple. This is really interesting because if you think about the brain's most complicated challenge is actually moving, and especially moving our body, moving our spine in a specific way. So our brain is using all of its senses to create this 3D map of our body, of where it is in space. And I mean, even though the brain is amazing, sometimes it might not get that information correctly. So if there's a joint in your lower back that hasn't been moving quite correctly, your brain may not know exactly where it is in space. So you may just bend over slightly to pick up a pencil and you get the most extraordinary pain. And that's because it just made a slight mistake, but it's that little mistake that may have put pressure on the nerve, just because your brain didn't know exactly where your spine was in space. So again, the best way to prevent that is really, the more you move and the more you move your joints, the better idea your brain knows where your body is in space, right? More movement is important. And how chiropractors may tie into that. So we look for those areas of your spine that aren't quite moving right. You know, we can feel those areas of your spine that might not be moving, and sometimes they can be tender and painful. So we can, through, you know, investigation, locate those areas of your spine that aren't quite moving right. And then our technique, whatever technique we may use, is designed to reestablish that movement back in your spine.
Question with what you just said, the techniques. Like I lived in Canada and saw a chiropractor, and then since I've been in Australia, I've seen 2 different ones. And for the most part, they've kind of always done the same thing. So is there kind of like one generic, not generic, but is there kind of one thing that they're always going to like feel and do, and kind of, I don't know the contraption he put me in, but you know, like it was just the same with all 3. And I was kind of like, oh, that's obviously something you guys are taught.
I think there was over 100 different techniques. Well, chiropractic is an art, a philosophy, and a science. And the art is the way that we move the joints, right? There's a pretty popular way of, you know, you probably see the YouTube videos where they crack and pop and get those joints to move. That's a pretty popular way. There's also instruments that you can use that are very gentle. But typically, if you were a client, you would have, just like you would have a cavity or a problem in a certain tooth, if you have a problem in your neck or your lower back, we would have to kind of monotonously adjust that same area to reestablish that movement and those signals. So sometimes it can seem like we're doing the same thing over and over, which we are, but it's to reestablish that movement of those joints. And yeah, some people like the cracking, the more physical type of adjustments, which is popular on YouTube. But yeah, there's a lot of different types of techniques. It just depends on maybe the chiropractor that you see, and many chiropractors have different tools. So, you know, I have some clients that don't like the cracking. So we use other techniques that still get the same job done. It's just, yeah, a different way of going about it.
So I do like the cracking.
Okay, nice. Yeah, me too.
But my mom was always like, no, you know, even if you crack your fingers, crack your knuckles, she'd be, nope, stop that. You're going to give yourself arthritis. Whereas Ben literally just goes like this and cracks his whole body. So I've always been, oh, don't do that. You're going to give yourself arthritis. What is the whole thing with cracking? Is it good? Are there some good kinds, some not so good kinds?
Well, I think if it's done by a professional, it's typically good, right? Yeah, you could, I mean, there's a number of different ways I could crack my knuckles. I could I could do it gently and specifically and make that joint sound, or I could just kind of jam them together and make that cracking sound.
Yeah.
So maybe if you do it really rough, it could maybe create arthritis over a period of time because you could be damaging those joints. But just making the cracking sound itself isn't going to give you arthritis. It's not going to damage you. If you want to know like the physiology of the cracking sound, there's fluid in our joints, like an oil. So when you remove our joints, that oil is allowing things to move smoothly, right? And it's surrounded by a capsule that's vacuum sealed. And so when you do the rapid adjustment, it kind of separates that ligament. And so the fluid in there turns into a gas. And so those gas bubbles popping like champagne bottles, that's the sound. It's the popping sound of the fluid turning into a gas because of the atmospheric pressure, and pressure outside is less than inside. So it turns into a gas. So the cracking sound isn't bad. And yeah, some people can stretch and their joints are more mobile. I think they may have a little more movement and fluid in their joints. Some people are very restricted, so their joints don't move as much. It's harder to get that cracking sound, but the sound itself isn't bad. It's maybe the way that you go about getting it could be harmful if, done by somebody who didn't know what they were doing. Or
like our daughter who did that once. She decided her back was feeling a bit tight after sport, and she decided she was going to twist and just fix it herself. Doesn't matter that she had a dad that trained for many, many years to fix that. And so we got a call. We're like, Kiara has to come into the clinic right now, please, because she's done something. So it's probably one of those like, don't try this at home things that I imagine would need a professional for it that studies for a very long time to do it properly.
Oh, it's not good to have somebody walk on your back then.
Well, I mean, I've been guilty of allowing my kids to do that myself. I think up to a certain age, and in certain controlled environments, it might be. I don't know. I wouldn't recommend it. I shouldn't say that in public, but I let my kids do it to me. But don't do it yourself.
Thank you. So, do you think why is chiropractic so controversial then?
There's a number of reasons. I think chiropractic, the beauty for me, we spoke about the art of how we adjust and the science of how the body and the brain connect. But the philosophy is, what really attracts people to become chiropractors. And chiropractic philosophy is vitalistic, meaning that, we believe that there's a vital force in us that, heals us and keeps us alive. Some people might call it their soul. As chiropractors, we call it the innate intelligence. And so once you start talking about vital energy and, life force and innate intelligence, the scientific community has a hard time with that. Basically, you can't measure it, so science doesn't like to deal with it. And so within the chiropractic profession, there's really two camps. There's the scientific camp, which says chiropractic is only good for, back pain, neck pain, headaches, and it has no other value. And then there's the other side of the coin or the continuum, which, looks at the body as a self-healing organism holistically. That's a great thing as well. But in a healthcare setting, you can't really advertise that, and it's hard to talk about that as well. So the reason why it can be controversial is because of the lack of understanding of probably the philosophy itself. When I first became a chiropractor, I was very on the medical side of things. We used to make fun of people who were vitalistic. There was a kind of a little war going on back and forth. But then the more I was involved and the more I studied, the more I understood how it's so important that the old guys that created chiropractic, 120 some years ago, were right about a lot of things. But the way that they explained it might be a little simplistic these days, and that we have a better understanding of how the brain and the body and that vitalistic energy works. The two camps have really kind of, if chiropractic was, more united with all of that understanding, we'd probably be a bit stronger of a profession at the moment. But that's kind of the controversial part of it, is probably the vitalism, I would say.
Yeah, and I think for a lot of us that are, I guess you ladies that are on here, it's that same theory, the power that made the body heals the body. The same way as we know if you cut your finger, your body will heal itself. If you are unwell, your body will heal itself, given the right environment and the right nutrition, and your body is made to heal. And so I think that makes it really easy for a lot of people who have that same idea already to understand how chiropractic can fit into that. At the same time, though, there's a huge amount of science behind chiropractic as well, right?
Yeah, Heidi Horvick in New Zealand is doing amazing work. She's written a book, and yeah, there's a lot of research coming out. But the problem is it takes about 15 years for the research that's coming out to actually be used in a scientific setting. So there's a huge delay in a lot of that. Plus there's dogma about chiropractic as well that kind of sticks with you. So yeah, but the science out there now, coming out now, is amazing.
Yeah, I love that. Thank you, Brian. I think for me, and like I said, I've come to see you for quite a while, but having a bit of an understanding of that philosophical side of chiropractic even makes me align even more, because obviously that's, like you said, Yvette, that's really my belief in the body's innate ability to heal and tapping into that. And, science, like you said, Brian, it takes time to prove and do all the research and show all the things that we kind of know to be true. So, that was an awesome answer. Thank you so much. I would like to ask, though, in relation to, so people like me injure myself at work, the whole medical system is right, or the workers' compensation system is, oh yeah, okay, go see your GP, who then refers you to a physio, etc. Like, how would this be better managed to have come and seen you instead off the bat?
Right. Well, just like you go to the dentist once a year to get a checkup, they will look at your teeth. Have you ever been to the dentist and they blow the air all over your tooth? And usually it doesn't hurt, but then one area is like, the air hurts that spot. It's called allodynia, but what it means is a non-noxious stimulus causes a painful response. So typically that air wouldn't bother you. The same kind of thing, if you were to come to a chiropractor, we can find those areas that aren't quite moving right. And sometimes, I didn't know that hurt, where you're touching there, because your brain's just not recognizing that. You don't have to even have a regular adjustment, but just to maybe get checked and find out where those areas are. And then if you have those, once we reestablish that movement of your spine again, showing you ways to stop recreating that problem. In saying that, there's 3 areas of stress that can cause your problem. It's either a physical problem, it's either a chemical problem, or an emotional problem. Those are the 3 major stresses. So if we go through your lifestyle, we would look at the physical stress, whether you're sitting too much or you're doing too much exercise or not enough exercise. That can be a stress. Like a chemical stress could be too much inflammation in your body. So a lack of what we recommend, like things like vitamin D and omega-3 fats, things that decrease inflammation. Diet, drugs can create a stress. And then, even emotional stress, if you're stressed out, if you're angry about something, your muscles tighten, you don't move as much, you decrease blood flow, and that stress response creates a problem as well. So going through and looking at those 3 areas, individually, and just removing those stresses can help as well.
And so generally you'll get people who they'll call in, for example, and they perhaps can't get in to see their GP. So they book an appointment at the chiropractor, and then they'll call back and go, well, I've managed to get into my GP. I have back pain, but I've managed to get into my GP. I want to cancel my chiropractic appointment. So between those 2, if I am a person who has lower back pain, for example, why would I see a chiropractor as opposed to my GP, or vice versa?
Right. Well, if it's your spinal health, seeing a chiropractor is a good spot to go, because, we're trained in looking for all the red flags for reasons why you shouldn't be at our clinic. And, we refer people out all the time. The fact that we focus heavily on the health of your spine is a pretty good reason to see a chiropractor first. And, it should be the same way. If you go to your GP first, and they find that, there's no red flags, you don't have pain down the leg, you may have a spinal problem, we'll refer you to the chiropractor. And, that happens with us all the time as well. So if all of the healthcare providers are, working together, it probably shouldn't matter where you see first. It ends up on who you see to take care of the problem. Typically, drugs and surgery are one side, and then more holistic ways of dealing with it are on the other side. But yeah, in an ideal world, it shouldn't matter who you go to first, but you should get the care that you need.
Ideally.
Ideally, in
I've
a
been
perfect world.
I've been referred lots of times to a physio and seen, used up all my insurance to see the physio, and nothing's changed. And then this is when I was a bit younger, and then down the line was told, no, you actually probably should have seen a chiropractor. And it was like,
Right.
Didn't know that.
Yeah, well, we're the only doctors that focus on the movement of those spinal joints. I mean, physios are fantastic at what they do as well, but they're looking more at the muscles and maybe the way that the spine moves as well. But, like the tools in the tool belt, they don't have a lot of ways of maybe reestablishing that movement of your spine other than exercises, which are important as well. But nobody really focuses on making those spinal joints move better again. So, yeah, I mean, we refer people, physios, massage, it all works. Just you need more eyes to, I guess, get an honest opinion
and I guess the right treatment for the right thing.
For sure. Yeah. I get people coming in and, they just have a shoulder problem and, it could probably help you with your shoulder, but you're going to get a much better experience if you see a physiotherapist who focuses on shoulder issues, use the proper tool for the job.
Can I ask you pregnancy related questions? Because obviously that's my boat.
Sure.
So like I have been seeing a chiropractor, probably not as often as I should, and predominantly because I've had a bit of lower back pain. Obviously, as I get bigger, like I'm trying to keep my posture as good as possible, but it's definitely more and more difficult. Why is it important for a pregnant woman specifically? And I'm thinking almost more like the pelvis and getting ready for birth, but then post-birth as well. Why would you say it's important for a pregnant person to see a chiro?
Obviously, the pelvis is very important. If everything's lining up properly, right, the pelvis will open up and it won't be as painful. The process just happens a lot better if things are moving properly and lined up properly. And there are some restrictions or some imbalances that can also affect the nervous system as well. And that can tighten up muscles and just create more stress around your pelvic region and those joints. Obviously, the less stress on those joints, the more the body is able to relax, the more the nervous system is allowed to communicate and do the things that it needs to do to allow for a healthy birth. Because your spine's going through a lot of changes as the hormones allow the spine and the joints to move more. Your weight is being displaced in certain areas. So certain strengthening exercises would be important for you. And just having somebody advise you on things like that from a spinal perspective I think is beneficial. But yeah, getting things lining up and moving properly just allows the whole process to happen easier.
Yeah, I have to say, I didn't see a chiropractor when I was first pregnant with Kinsley. And just an hour into work, my lower back would just be screaming. And this time has definitely been way better. Yes, if I do like a really long day, or I'm on my feet kind of the whole day, it aches, but I haven't had any of that sciatica pain that I had with the first one. It's definitely, I think it's the chiro that's made a difference. And what you said, working on some of those muscles to try and keep my posture as good as possible. But I have been told that it would be beneficial to see a chiro for both mom and baby very soon after birth. I haven't done that before, and obviously thinking about it this time. So what is kind of the reasoning behind all that?
Well, the spine is important no matter how old you are, from a day to 110, our spine is so important. And just like an adult can get those subluxations or those areas of the spine that aren't quite moving right, those areas can be irritated. Those spinal joints can be irritated from the birthing process is a major stress, depending on how the baby's lifted, especially the upper cervical region. There's a lot of if suction are used or if there's any force, and just the position of the spine, just to make sure those joints are moving properly. Obviously, it's a totally different technique because of a newborn spine, the bones haven't solidified. So it's a technique that, you would use about as much pressure as you would use to make sure that your avocado is right. So it's a very gentle pressure. Is the technique that I've typically used. There are some instruments as well that you could use, but the brain is communicating to the body as well. And, just like an adult, if your spine's not right, you don't feel comfortable, you're going to be grumpy. And if, those joints in a baby's spine can not move properly as well. And so they can be irritated by those joints as well. So just finding out if those joints aren't quite moving right, and then using techniques to reestablish that movement can really help.
Would you say even the birthing process coming through the birth canal would be quite kind of stressful anyway for a child potentially with that anyway. So just making sure that they're, things are where they're meant to be, and coming out into the world and they're lifted up and everything's kind of stretched out. So there's so much happening.
Yeah, it can look a little bit rough, and there's the techniques that put a lot of force on the neck. So obviously, and those ligaments and tendons, they're not that strong yet. So that can definitely cause some injury, and even, and if it's not addressed later on, it can become those problems that just grow into something as you get older. So, it doesn't hurt to get the spine checked and see if there are any of those areas that aren't quite moving right.
I consider Savannah's birth, like we were doing all great, and then we had to get the vacuum suction thing. So if you had to consider, like, as an adult, being vacuum sucked by your head down a really, really tight tube very quickly, right? Because then it was getting touch and go there. So there was definitely just logically, there's going to be some kind of pressure. And I guess, like everything else, right? Like, as Brian says, like if there's something out, there's obviously a lot more reason why kids would be, cranky for no particular reason, but they can't tell you what's going on. So.
Yeah. I had a girlfriend just have a baby a little while ago, and the baby has tongue tie, and they've started seeing a chiropractor. They had the surgery, but they've been recommended to see a chiropractor just to, I guess, one side, I think, of the baby's neck is tight. If that makes sense. I think that's what she said. And she said it's made a huge difference. So
nice. Yeah. I mean, you can see if your baby can turn to one side or not the other. I mean, you get latching problems on one side and not the other. A lot of people don't realize it until I point it out that, can you see how far she can turn her head this way? And then you take a rattle and turn it the other way, and it wants to look at the rattle, but it's not turning. And a lot of mothers do pick that up, but sometimes, that's a very early sign of something may not be right.
If you don't pick it up, like if I don't pick this up and it goes on and I don't see a chiropractor, does it compound? Does it get kind of worse as people get older, or is it very like situational?
I think it depends. I mean, the body can heal itself, and it doesn't want those areas there. So, I mean, it's going to try and move, and that's why you feel like you want to stretch. So I like to think that a lot of, especially kids, they heal very quickly, and their joints aren't as locked up. They can probably work themselves out of that. Sometimes you might need chiropractor just pushes it in the right direction, and then the body can take over from there. When they're young, I don't have to check them as often once things get going. But the longer that problem doesn't correct, the longer it sits in there, the harder it's going to be to correct. Arthritis, like any joint in our body, needs to move. And if it's your spinal joint, or if we took your finger and we strapped it up for a few weeks and we didn't let it move, after about 3 or 4 weeks, we could x-ray that joint again, and we could start to see some arthritic changes just from that lack of movement of that joint. And that's where a lot of spinal joints arthritis, spinal arthritis comes from, or any joint, is just from that lack of movement. So if a kid has that for a long period of time, as an adult, that's where you get chronic problems, headaches, neck pain, because it wasn't addressed early on. It's easier to fix them when they're young.
So are there particular exercises or types of exercises that you would recommend?
Yeah, well, we have some really simple, we call them spinal hygiene exercises, free on our website, but just getting up and twisting, it's just extremely simple stuff like side to side, just to establish some movement in those joints. Nothing complicated. For your neck, it's just tilting, rotating, kind of like what you would do during an exam. Those are the types of exercises, some simple stretches, but movement. If you just think of movement, just keep them moving, get up and dance for a couple of minutes.
Oh, I like that one.
But this isn't designed for any one person, obviously, but generally for people, just really simple movement.
Yeah. So my question is about running, because I am a runner, and I have another friend who does functional patterns and running is not good for you and all this stuff. What, as a chiropractor, is your take on running? Is that bad for my spine, for my joints?
I guess it depends on who you are, like your body size. I think we're all designed to run a little bit, but it depends on how much. And if your spine is in line and your joints are moving correctly, go for it. I think too much running, like training for marathons constantly, can really burn out your joints.
Into your body, really, because I've done a couple
sure.
half marathons, and I know I don't think I'll ever do a full marathon. I don't want to put a limitation on it, and I'm not using this as an excuse. I don't know if my body could do a full marathon. Like a half feels like a stretch.
Yeah, of course, listen to your body. Yeah, if you are running and you feel great and you never feel sore afterwards, and then that's probably something to do. But if it takes you a couple of days to recover, then maybe back off and do some other strategies. You don't want to do too much.
Yeah, just finding that balance.
Walking is way more natural. Walking and sprinting, I like a lot more than the long hour plodding with a high heart rate. I don't think is very healthy, but walking is great. Get your heart rate elevated to a certain amount without going too high. And then every once in a while, a couple of times a week, doing some sprints where you get your heart rate up really high and then you let it come back down is a really good health strategy.
That was actually, thanks, sorry, Jess. Leading into the question that I was going to ask was actually around, is there a particular sport or exercise that's like the worst thing for your spine? Because my son plays rugby and they get tackled sideways all the time. And I'm thinking all the time about the amount of damage that will be, the impact. And when you talked earlier about your brain preparing for where you are in space and then something hits you, it's a bit like a car accident every day and multiple times a day. Surely that's going to lead to a lot of potential damage.
For sure. Yeah. Rugby, that's a lot of trauma. That's why the guys that have been doing it for a long time in their 30s, 40s, and 50s, they're, knees and ankles and elbows and shoulders and spines. There's some definite wear and tear. Other sports, obviously, swimming, low impact sports are really good. I like walking and sprinting, and you have to lift something heavy occasionally. So not too heavy, but enough to stress your bones and your muscles. So, a couple times a week, weightlifting, because it's good for your bones, right? And your ligaments and your muscles. Golf, the more golf.
That seems like a slightly biased opinion, right?
Yeah.
No.
That's actually a good point though, Karen, because I guess for any sport, we see a lot of athletes that come through the clinic. And certainly, like, I would imagine if you have a child who is an athlete, so our daughter growing up played a lot of basketball, but also rugby and volleyball and almost every sport she could get into. But I would say that if you have a kid who is an athlete, it would certainly, for any of them, it would be a good idea to get them checked, because even for basketball, netball, whatever it is, they get smacked pretty hard at times. And even if they're not an athlete, toddlers are like a nightmare. Jessica's nodding so hard.
Yes.
For kids in general, people are kind of, why would I send my kid to a chiropractor? And I think very often, if we had to do what our children did every day, it would make perfect sense to us why our bodies wouldn't necessarily be aligned, right?
For sure. And I mean, there's been some studies, I wish I had them in front of me, that have shown where athletes have performed better after having an adjustment because of that brain to body awareness. They're able to coordinate everything a little bit faster. So it gives you that, sometimes it's a split second edge between first and third place. If your body and your brain know exactly where they are in space, you'll probably be a little bit more coordinated. And so they tested people before and after an adjustment with a vertical leap, and there was some pretty decent research to show that it helped increase a vertical leap. And there's been some other studies as well, but
we could probably put the reference to that in the show notes for any athletes or parents who want to have a look at that one, because that's a pretty cool study. Yeah,
it makes sense.
If you're a person who is kind of going along and every now and again you get like a little twinge in your spine, I'm thinking of this from our clients who they call us and they are in extreme pain. They've never seen us before, but they're in extreme pain and they need to see somebody immediately. But very often there've been little twinges that have kind of given them some warning. So my question to you is, why should people not ignore the twinges?
It's your body talking to you. Your body talks to you all the time. And so, you should, there's something not right. And maybe, your body took care of itself, but you should still probably get it checked, kind of like when you have a cavity in your tooth. You don't really notice it's there until it's this big mess, right? But if you got it checked a while ago when it was tiny, you would have gotten the small drill instead of the big drill. So if you can get those twinges early, you might be able to correct something small as opposed to, once it's, you're missing days from work and it's extremely painful and it's affecting your daily life. Getting it checked before that point. And even, you may feel like I don't need an adjustment, but we know that spot's not moving correctly. So having an adjustment can get those joints moving properly again.
And then, so that was me now. I'm in my extreme pain and I'm wanting to come in to see my chiropractor. Is it reasonable for me to expect it to be corrected in one visit or perhaps two?
Well, I mean, it depends. Sometimes it happens, but other times it takes, if that's been there for a long time and you've tried other things and it's been going on for 6 months or a year or more, it may take some time to unwind some of that stress that's been there. That's why, just like going to the gym, right? You can feel great and maybe even, look better after one workout. But if you work out regularly over a period of time, you probably are going to get better results. So if something's been stuck there for a long time, it might take some time to unwind that.
And I guess for some people, like I'm an example of this. So I was a dancer for most of my life. I still fancy myself one, but at the moment it's just in the lounge room. I am getting back to it though, and seriously, so watch the space. But in the particular form of dancing that I did, there were a lot of head rolls, lots and lots and lots of head rolls. Usually I had a very, very high pony on the top of my head, and the faster I could make that thing swing, the better for me. And so even though Brian and I have been married for well over a decade, and I've been seeing him for that long, the same spot in my neck goes out every single time. And I'm grateful that he knows exactly where it is. But because from all those years of swinging my head in the same direction over and over and over again, I used to train every day. That same little spot keeps going out. And so I know that for the rest of my life, that same little spot will need to get put in, right?
Probably. I'd like to believe that, your body will heal that spot, but I mean, the body doesn't like change. There's habits, there's, postures and physics. So if you've got certain postures, you're always putting pressure on the same spots. There's gravity. So a lot of those stresses in life aren't going to go away. So you may need something just to keep you going.
Yeah. I've even noticed for myself, I have my computer screen sometimes. Our daughter pushes my computer screen at an angle, so it's not straight. And so without me even realizing it, I'm sitting on like the left side of my butt cheek instead of the right. I'm not sitting equally. Karen's trying it out. If you're watching us on YouTube, Karen's trying it out. But just because my computer screen is not completely straight on my desk, I'm sitting like slightly on the one side more than the other. And within a day, I have low back pain from that. And so it could be like the teeniest, tiniest thing on your desk that's causing, or something that you're doing, like when you're driving your car and you're, pushing on the accelerator and whatever, just that more pressure on the one side of your body than the other. On a daily basis, right?
Right. Yeah. Like having unbalanced tires on your car, you just put more wear and tear on, so the tire is going to wear a little bit more.
Super cool.
The body is super cool.
The body is super cool. I'm just readjusting, straightening my spine right now. I have another just a quick question, Brian. So do you as a chiropractor, is it a thing like you'll be in a room and you'll be like, that person's not straight, that person's not straight. They're sitting crooked, her head's like this, because I'm sitting here like trying to really straighten my head and my face because I can see myself. Is that something that you do as a chiropractor?
It is a bit of a party trick because sometimes the husband will accompany his wife into the exam room when I'm seeing him for the first time, and I'll look over and I might say, well, how long is your left hip been bothering you for? And he's like, oh, how did you know that? Or so, yeah, some of the things are pretty obvious that weren't very obvious in the beginning. Yeah.
I guess we all do. We even laugh kind of in the clinic because and actually even our children, because they've been around that, we'll walk behind somebody and Savannah will say, Mommy, that gentleman needs to go and see a chiropractor.
Aww.
She's got an eye. She does not want to be a chiropractor though, but no, but
Not
she's
yet.
got an eye for it. Not yet.
Not yet.
She's working on it.
Got to pass on the business somehow.
Oh, thank you so much for your time, Brian. I've learnt lots today. That's been really, really helpful. And I will be coming to see you in the next 7 days.
Thank you. It was fun.
It was so good, so informative.
Thank you.